Oh, hey there. This is Dr. Evan Osar with Integrative Movement Insider. Happy Sunday. Hope you're doing well. Just working on my deep squat. Probably looks kind of weird to show up there and see me in that position. However, this is a conversation about perspectives on deep squatting, and especially if you're working with older population. And again, older is relative, and or clients that have common orthopedic issues like knee issues, like low back issues, like hip issues, and whether or not we should deep squat our clients. Got a couple things for you here today. First, I want to thank you for being part of our community. Thank you for being a health and fitness individual and sharing your passion, sharing your knowledge, sharing your commitment to helping transform other people's lives. I mean, to me, there's no better profession than being a teacher, whether that be a teacher in the role of a pastor, priest, someone serving in the school system, and just imparting knowledge and helping people think differently, not imparting your beliefs so much, but helping people think better about themselves and think differently about knowledge and just learn how to think, the process of thinking. That's what a real teacher does. So that also extends to obviously parenting. So parents out there, you know you're teaching every single day and your children are watching you every single day. And it also relates to us as health and fitness professionals. We get to teach our clients every single day, to educate our clients about their bodies, educate them about the importance of moving well and seeing the transformation. So whether you're a teacher in the role of a traditional teacher or pastor, priest, or religious spiritual leader, and or a parent or health and fitness professionals, we're all teaching others in some capacity, helping to transform lives with our knowledge, our skill set, and hopefully we're bringing our humility to it as well, so people can see that we're just real people too, just living our lives and struggling with a lot of the same things that they're struggling with. This just happens to be our area of expertise, and we're helping to share that. So thank you for allowing us to be part of your community as you become the leaders or are the leaders in your own communities and share your information, your wisdom, your knowledge, and your passion with your clientele. So this is Thanksgiving weekend, and the start of the holiday, the unofficial start, or the official start, I should say, of the holiday season here. So I hope you keep that in mind as you continue to serve your client through this busy, crazy, and awesome time of the year as well. Now, to our discussion about the deep squat. I was having a conversation with a colleague, and she's a really thoughtful fitness professional and really cool approach. I really like her approach because she's very purposeful and very specific and thoughtful about how she approaches it. And she asked me, as we're talking about the squat, and I want to learn a little bit more about Olympic lifting, to learn about some of the mechanics of Olympic lifting and how they're different from traditional lifting, slightly different. She asked me, what's your purpose when you teach someone to squat? And I'm like, well, several things. One is a fundamental movement pattern for everyday life, to get into a chair, to get down deeper, to grab something heavy off the floor. Squat is a great pattern. It's a functional pattern for everyday life. Now, understanding that that's not a good enough reason, the squat pattern also allows me to train posture, because during a squat pattern, as the way we teach it, we want our clients to align their thoracolpelvic cylinder, the rib cage over top of the pelvis, maintain that. The other goal with the squat pattern is to hip hinge, to teach our clients how to load their hips, how to effectively load to get lower, so they're not overloading their knees, so they're not overloading their spine as well. So many different reasons for why we teach a squat and for how we teach a squat pattern for most of our clients. Most of our clientele that we see in our clinic and in our practice, we get some higher level individuals. Like I'm working with a guy now who like his goal is to snatch like 300 pounds. And if you think about the snatch position, I mean, that's a massive load for someone that he probably weighs somewhere around the 170 range. So snatching 300 pounds is massive. And we're working together. He said he split jerk, 215 or 220 the other day. So he's super strong guy. So my goal with him is going to be a little bit different than my goal when I'm working with someone that has orthopedic issues with their knees or their low back, or is just new to exercise and or struggling with some of their movement patterns. So I'm going to start you first with the deep squat, and then I'll work the way back as to how we train our clients and why, because it's really about perspective. And it's not about who's right or who's wrong. It's really just perspective. So let's take the deep squat. I'm going to use this bar here. It's a 30-pound bar. So first of all, when we're doing a deep squat, especially a barbell back squat, for example, you need a lot of range of motion. Your client needs a lot of range of motion in their thoracic spine. They need to have that thoracic extension and still be able to maintain their rib cage over top of their pelvis. They need the shoulder range to get the shoulders in the right position and get their elbows in the right position. I should say not the elbows, but the shoulders in the right position, so they're loading the bar appropriately. You need to have them, they need to be able to have the appropriate range of motion in their hips so that they can get down deeper into this position and load their hips appropriately, obviously loading the entire lower extremity, loading the core as well. But again, I can get down into that position. So the question isn't, can I get down there? It's, should I get down there using the strategy that I'm using? As you can see, I go right around here, go into posterior pelvic tilt very rapidly, and increase lumbar spine flexion. So again, when you're deep squatting, that should be part of, or that should say that is a part of normal mechanics. However, what I'm doing and what many people do in the squat pattern is they go too fast and they go too rapidly. They end range. So what I'm doing here is I'm end ranging my posterior pelvic tilt and lumbar spine flexion way before I should be doing it. When we're deep squatting, we should go gradually into posterior pelvic tilt, gradually lengthening the spine so it's not this rapid and sudden movement, because that's what ultimately starts to drive some of the issues with the deep squat pattern for our clients that don't have the mobility and or stability, people like me, in that pattern, because that's what starts to load the spine in a compromised position because they've locked up the thoracic spine. So now they're hypermobilizing through the lumbar spine because of their lack of range in the thoracic spine as well as through the hips as well. So that butt wink is really rapid posterior pelvic tilt, rapid lumbar spine flexion. If you watch the good lifters, they're really good lifters, like my client who's deep squatting, I should say whose goal is to snatch 300 pounds, his squat doesn't look like my squat. His squat looks more, he maintains a cylinder through longer periods of time of the motion. He doesn't end range posterior pelvic tilt and lumbar spine flexion. So again, it's just a perspective. He can do it because he's developed the range of motion and the competence in that pattern. I haven't. I'm working towards it, but it's not a great pattern for me to do right now, because if I do it too much, I'll start getting some numbness and tingling in my foot because I'm rapidly overloading and significantly overloading my lumbar spine. So those are the things we want to think about with our clients as well. Not should they, yes, should they be doing it, but are they using a strategy that will allow them to do it safely and effectively, not just saying they should do it because everybody should deep squat because that's what we did as babies. That's true. We all deep squatted when we were babies. Most of us deep squatted when we were babies. And if we didn't interrupt the developmental process, most of us would still be able to deep squat. But we've moved far and away from that in modern culture, and especially our older population, older just being relative. I'm kind of an older guy here at this point. So we moved away from where we can deep squat, and it's not to say you can't work your clients to that. I'm just saying for many of our clients, it may not be appropriate. So that comes to our next option. So a box squat or sit to stand from a chair position, much more effective for many of our clients. Here's why. Because when our clients are squatting, the bench squat or box squat gives them a target. Many of our clients don't get a lot of anterior pelvic rotation when they squat, so they're afraid of falling backwards because they go rapidly into posterior pelvic rotation. So this allows them to ease that fear. It gives them a target as well. It allows them to align their thoracolpelvic cylinder and work through a range, because you can always elevate this range as well. It allows them to work through a range where they maintain the cylinder position and really work on the eccentric loading, the lowering phase of the pattern. And again, you can load this pattern up. So for a lot of our clients with shoulder issues, for spine issues, they don't have the spinal mobility or stability, this is a safer position to load your client up in, and they can maintain better alignment through their shoulders. My shoulders can stay more open and wide. I can maintain better alignment through my spine, and I can really work on my hip hinge and sitting into or onto the box without that compensation that happens with a barbell squat and or that deeper squat. Now, we can also backtrack that even a little bit further. And again, this will be oftentimes a warm-up position, or when our clients are dealing with orthopedic issues, this may be one of their corrective exercise patterns I'll have them do, a supported squat. So now I have the client, similar alignment of their head, neck, and thoracolpelvic cylinder, and now they're working on just holding on with the handles. And if a client doesn't have these handles, which many of our clients don't, use a doorknob. Doorknob works well So we have the client just sit down into their squat pattern, maintain alignment, the same idea, working on releasing through the posterior hip complex, aligning the hip, knee, ankle, and foot complex, and maintaining this position so they can work on the mechanics of it as both a functional warm-up and or a corrective exercise if they're dealing with some orthopedic issues, like some chronic low back issues, hip and or knee issues. It really helps to develop the mechanics that we want our clients to have as they get into a more body weight type squat and or loaded type squat. So just 3 different variations, I should say, a different sort of perspective on it, but doesn't make any of them incorrect. It's just, is your client set up for success? And that's really what the question is you want to ask your client or yourself as you're setting up your client's exercise progressions. Is your client set up for success? Do they have the alignment, the ability to align their joints for the exercise? Can they maintain that alignment and control? So that's the alignment and control of our ABCs, align, breathe, and control. Can they maintain their breathing appropriately through the exercise pattern? And can they control it through the depth that you want them to control it? And that's really what our exercise progressions are all about. It's not right or wrong. It's just those are the components that we're looking for. And that's what we basically teach as part of the Integrative Movement Specialist Certification Program. Is we teach you the fundamentals, the anatomy, the biomechanics, and the motor control of movement. And it doesn't mean that there aren't other approaches, and it doesn't mean that our clients shouldn't be able to do things like deep squat. It just means sometimes our clients come to us and they have issues and they have medical histories that maybe inhibit them or prohibit them from getting to those positions in their current state, and maybe they can work towards that. But it's understanding how should the body move, and then where are they at, the ability to assess them, use the most appropriate corrective exercise strategy and or sort of movement prep strategy, and then how do you progress them, what patterns do you use with them to help them safely and effectively achieve their health and fitness goals. And that's how you become that go-to specialist for your current clients. You differentiate yourself in the industry, and you really help transform your clients' lives because you're giving them strategies that they can not only use with you, but you're helping to prepare them for everyday life and the activities that they need to, want to, and even love to do. You know, I belong to a club right now where they play pickleball, and I see people of all ages, like young people playing with old people. It is so great because some of these older clients, older individuals, they're quite active and quite good at what they do. So even they're wearing the braces and they may be limping around afterwards, but on the court they're super competitive and they're super awesome. They kick my butt. So I'm not very good, but that's not saying a lot. However, the point is they move really well. So there's lots of clients that are just like that. So again, the goal, I should say, the purpose of this episode was just to give you perspective, and that's really what the Integrative Movement Specialist Certification Program is all about. We're starting the new enrollment for the 2023. So the program is a 11-month program, so it's an intensive program where we teach you the fundamentals, anatomy, biomechanics, motor control. We teach you how to put this into a context of assessment and corrective exercises. How do you assess your client based upon your foundational knowledge? How do you choose the most appropriate corrective exercises? And then how do you appropriately and safely progress your clients, especially clients that have orthopedic issues, like knee issues, like low back issues, like that have shoulder range of motion issues? And then how do you choose the best functional exercise progressions? So we're not here to change your mind. We're not here to, say what you're doing is like do things our way. No, we want to build upon what you're already using with success. So to build upon your knowledge, your skill set, and your experience, because many of you have more experience or as much experience as I have, or maybe even more experience than I have. So it's really just to help make you a better health and fitness professional that you already are, and to really address some of those issues that you see commonly with your clients, the clients that struggle with just basic exercise, that struggle with progressions, like just getting to the next level progression. So we'd love to see you and have you if you're a like-minded, open-minded individual, which you probably are for being part of our community. So the enrollment is starting now. I'll put the link in this video wherever you're watching it. And if you have any questions about the program, if the program is right for you and the clients you serve, just reach out and we'll be happy to have that conversation with you to see if you're right for the program and the program is right for you and the clients that you serve. So again, thank you for all you do. If you have any questions about the enrollment for 2023 Integrative Movement Specialist Certification, just reach out, let us know. We look forward to seeing you next time where we'll continue this discussion about perspective, and we'll talk more about scapular retraction and when and where should we have our clients scapular retract, and where can it maybe be detrimental to some of our clients' range of motion and or shoulder stability.